Hi, I'm Tom Dart, Sheriff of Cook County. I've been sheriff now for 15 years, and this is my Take 5 for mental health. Mental health means a lot to me and always has on multiple fronts. There's the obvious reasons that are articulated by people much smarter than me as far as it is literally our essence, our whole being, and mental health, frankly, without it, we are non-functioning. I think now society's come around to understanding it impacts all of us. And there isn't a family that I know of that doesn't have this issue in one form or another. And so I think the public is finally coming to understanding that this is the most preeminent thing that is inherent in being a human. And it is something that needs to be looked at absolutely no different than your physical health. So for me, on a personal level, it's always been that. On a professional level, once I became sheriff, it became abundantly clear that our society had horribly mistreated people with mental illness over the years, and for decades, if not over a century, have been dumping them by the thousands into jails and prisons around our country. So on a professional level, it's been something that's been very important to me for quite a while now, too. Breaking down the stigma of mental health is something that people have strived to do for decades and decades and decades. And it has been a challenge. I think the best way we can do it is to be open in talking about it, in terms that people understand and can relate to. The other methods I've seen and heard about, they're very good. But what we're trying to do is get people's hearts and minds with us. And it's such an easy sell. No topic is more significant than this. But the reality of it is you have to connect with people, and you connect with them by personalizing it. So the stigma goes away when we personalize it for people. The disparities and inequities in the mental health system are immense. And I unfortunately see that each and every day. Entire parts of our communities have no services. And people say, what do you mean by no services? I mean, no services. They don't have any. And someone can point to maybe a facility, maybe a doctor, some of them may be general in the area, but the ability for people to access it is non-existent. It's the very reason why I started so many mental health programs in the jail was because of the fact that it was that when I had people who we had diagnosed and treated for mental illness issues in the jail, when they were leaving my place, they had nowhere to go. They had nowhere to connect. I had nowhere to connect them to. And so a lot of my programs and this case management I do all emanate from the fact there were no services out there for people. There's so many areas of mental health that are overlooked. It's hard to nail down which one precisely. I think the area that we experience and I experience that is so underappreciated is the case management component of it. There seems to be a lot of understanding about dealing with crises and dealing with individuals who are in crisis, and that needs to be done, and I get it, and we utilize those services all the time. But it's more of the maintenance side of things where I think we fall down a lot, where it's not as if the individual said, I don't need this anymore. It's that we aren't tracking it and we aren't staying with that person. And we aren't, frankly, in that person's world where we need to be, which is that they have a lot of other challenges and a lot of other things pulling at them. So it's not as if you can just send a note out to them saying your next appointment is such and such. No, you need to really work your way through this in a very serious way. And I think we fall flat a lot on that. I find as far as routinely working out to be wildly helpful. I know, as I get older, doctors want you to do that anyways, and I understood that. But from like a mental health perspective, it's great because it makes you feel at least you have one aspect of your life completely within your control. I just wanted to thank the Jocelyn Center for doing this. Just Take 5 for mental health. This is my variation of it. But more importantly, doing it, I find to be a very thoughtful, impactful thing, particularly given everything going on in our world right now. Something like this is significant because people can find 5 minutes to work on their mental health and connect. But more importantly, frankly, the things that the Jocelyn Center does are absolutely amazing. If we had more of you, you would need much less of me. So please, anybody who is engaged, I thank you. Anybody who supports you, continue to do that. It is just vital for our community and our society. Thank you.